All right, I'm here today with Tony Sharp. Before you came here to our clinic, what was your life like with your hearing? Do you have tinnitus or
Yeah, actually, I was diagnosed with Meniere's disease,
Okay.
and so I got the tinnitus. I mean, everything that comes with Meniere's disease. And when I was diagnosed with the Meniere's disease, they told me that I would more than likely lose the hearing in either one ear or both. And I ended up, this one went first, and then the second one started, getting worse and worse. And I just went to a warehouse club, Sam's Club, and they were setting up a thing where they were going to be selling hearing aids. And I was trying to get some answers, just because obviously I knew I needed something. And he was more interested in selling the hearing aids than he was at helping me. But I got hearing aids there, and it wasn't very good customer service. I mean, I would have problems with the hearing aids. I'd set up an appointment to go in there, and they wouldn't even show up for the appointment that I'd set. To them, this was just a side thing. I mean, I've said before, I mean, I decided I better talk with people that hearing and hearing aids was their main focus, not, somebody that sold trash bags and things in bulk, so thankfully I found you guys, and it's improved things a lot.
Well, how did you hear about our clinic?
I started looking around on the internet, and then saw some advertisements, that little flyer that came in the mail, and I called a couple of places, and when I mentioned Meniere's disease, they acted like they didn't even know what I was talking about. But when I called here, I said, I have Meniere's disease. They said, okay. I mean, they knew what I was talking about, and we got into conversation. I think I was kind of feeling them out a little bit. Do you really know what I'm talking about? And they did. And so that inspired a lot of confidence in me. Just, even though I'd called a couple of other places, like I said, they didn't seem like they really knew what Meniere's disease was. And I wanted to be doing business with somebody that knew what they were doing.
Meniere's disease can be a little bit tricky. In a lot of places, I think that focus on sales rather than treatment.
Yeah.
The educational background and whatnot, they probably aren't, aren't really ready for something like Meniere's disease, or they just don't know about it because they weren't taught. If you're working with a hearing aid salesman versus a doctor of audiology, there's a big difference on that background there. What were you hoping that treatment would do for you when you came into our office?
Just that I would be able to hear a little more normally, because even with the hearing aids that I had before that I got from Sam's Club, it didn't sound natural. I couldn't hear very well. I mean, it was better than not having anything, but, still, it just wasn't all that big of an improvement. And I wanted to be able to hear more naturally. I wanted to hear better, and I wanted to be dealing with people that knew what they were doing rather than just doing this as a sideline.
Yeah. What were the hardest parts of living with your hearing loss before you came in?
Oh, just not being able to hear, especially women's voices. I'm not sure why I can't hear in that frequency, but anytime I would be talking with a woman, I was just guessing half the time what they were saying. I remember going to my son's home, talking with him and his wife, and I could see she was talking. I was aware she was talking, but I had no idea what she was saying, and it was just so frustrating, you know, especially when someone speaks kind of softly. And I just, I wanted to be able to know what people were saying. I wanted to know what was going on around me, whether I was driving, whether I was taking a walk. I mean, it just, there's a really bad feeling of not knowing what's going on around you.
A lot of our patients talk about how they can hear, but they don't understand.
Yeah.
And then many of them talk about how frustrating that can be. Did other people notice your problems with your hearing too?
Um, yeah, I, people in my family, they would talk to me, and then it was just getting frustrating for both of us. I couldn't hear them, they couldn't be understood, and I could tell people were avoiding talking to me sometimes, and that's frustrating, and there were times in stores, um, I was in the grocery store, and apparently there was somebody behind me trying to get to something, and she must have said something a couple of times, and I didn't hear it. She finally got kind of irritated and came and reached around me and gave me a dirty look and basically told me to get out of the way, but I had no idea she was even there.
Oh, that's kind of a hard story, and I'm sorry to hear you experience that. When you first came in to Timpanogos Hearing and Tinnitus, what was your first appointment like?
Just as soon as I came in, I mean, I could tell they knew what I was talking about. I mean, like I said, down at Sam's Club and a couple of other places that I called before I called here, when I mentioned the Meniere's disease and how not being able to hear, and plus the balance issues with the Meniere's, they understood it here, and nobody really had before, and they immediately started helping me understand how I could be helped. I mean, where before it was just, here buy these hearing aids and your hearing will be better, and who's next in line. I mean, they were actually taking the time not only to find out what I needed, but kind of letting me know how these things would help me, not just, okay, here it is, now, hurry out the door.
Did anything surprise you about our evaluation or treatment process?
It was a lot more thorough than, I mean, when I went to Sam's Club to get the first ones, I mean, just very, very brief hearing test. It was just, okay, you need help in these, these will help, okay, that'll be this much money. I mean, you guys took the time to give a very thorough hearing test, and it wasn't just one thing. I mean, there were several tests that we went through, and they really found out what I needed rather than just, you know, I guess it sounds clever. It was more they wanted something just to show me, see, you need this, you know. And I just felt like you guys knew what you were talking about and you were actually trying to help.
Yeah, I find it really frustrating that the basic hearing test, or the things that most states, including ours here in Utah, require before you can fit a hearing aid to somebody, is a very basic, bare bones hearing test that skips so many parts of the diagnostic process. I don't know how you can choose the right hearing aid for an individual without going through about a 7 or 8 step different testing processes in order to get a really deep understanding, like how well can you hear a noise, what's going on with your cochlea, is there a problem with your eardrum, what about those 3 little bones between your eardrum and your cochlea. There are tests for all those things that are painless. They don't take a lot of time, but they reveal a lot of information that helps us select not just the most expensive hearing device or whatever a sales rep says this is the best or whatever. There's so many hearing aids out there that if you don't take the time to really look deeply at the person as a whole and what their hearing needs are and all those tests, you're just guessing. And I personally find that very frustrating about our industry. What changes have you experienced since starting treatment here at Timpanogos Hearing and Tinnitus?
Just, I guess the most obvious one is I can hear a lot better. Um, People, like members of my family, I think they were pulling away before. They knew I couldn't hear, and it was frustrating for both of us, so they were just not interacting with me as much as they normally would have. But since then, it's just more natural, where before they would talk to my daughter or whoever else was around, now they're actually talking to me, because we can actually have a conversation again instead of me just kind of looking at them nodding like I know what's going on. Now I actually do know what's going on.
It's all about those connections. There are so many benefits with treating hearing loss. Cognitive load and improvement with balance for many people. But really what it comes down to is keeping those relationships, those connections with family and friends, makes all the difference in the world.
Yeah.
So how has this treatment changed the way you feel about yourself?
I'm more confident that I know what's going on. Before, people would say things, and I was kind of guessing at what they had said. As an example, they might say, okay, we're going to go do this. And then I put a lot of responsibility on my daughter before. After I'd have a conversation with someone, I would be asking her, okay, is this what they said? But now, occasionally I will still ask her, did I get that right? And usually I did. It's a lot different. I feel like I know what's going on. I don't feel lost, like the conversation has completely gone past me. I feel like I'm a part of the conversation rather than just sitting there listening, trying to listen like I did before.
There's 42 million Americans who have hearing loss, and only a small percentage of them are doing anything about it. What would you say to someone who's hesitating to get help for their hearing loss? Or what would you want other people to know who are struggling?
I would say just talk to somebody that knows what they're doing. I mean, don't waste your time going to someone who's just a salesperson. Like I did at Sam's Club. I've been in sales. I'm not putting down salespeople, but it's just there's a huge difference between someone who's just selling hearing aids and someone who's trying to help you with your hearing problems. So I would say go to someone who knows what they're doing. Don't just take the easy way out, because I feel like I just wasted my money with the first set of hearing aids that I got, because they weren't what I needed. They didn't help that much. I was just throwing money away. And coming here, it has actually helped me more than I would have believed. I have the confidence of knowing that I know what's going on. Whether it's with family, friends, or just out in public, I know what's going on. I can hear what's being said to me. And I wish I would have come here from the very beginning. So if anyone's thinking about getting help, I'd say just please do it. I mean, it'll make a big difference in your life.
All right, Tony. Well, thank you so much for spending a few minutes with us today. Just in closing here, what would you say is the single biggest benefit you've experienced with your hearing treatment and your experience at Timpanogos Hearing Tinnitus?
And I'm more at ease when I'm dealing with people, where before I was just nervous. I didn't know if I was understanding what they were saying. I didn't understand what the conversation was about. I remember asking people, can you give me some clue as to what the subject is? So maybe I can follow along. I mean, now I don't have to do that anymore. I can hear people, and like I said, I really had a problem hearing women. Now I can hear them too. I mean, I think I probably offended some people because I just didn't respond to them appropriately, and now I can do that.
Well, I'm super happy you're seeing the benefits there. Thanks again for spending a little bit of time with us today.
And no problem.